Are you suffering from arthritis pain? Have you been looking for a natural remedy to help alleviate your symptoms? Look no further. Vitamin D may be the solution you've been searching for. Studies have shown that vitamin D plays a crucial role in reducing inflammation and pain associated with arthritis. By increasing vitamin D intake, you may experience a decrease in joint discomfort and swelling. Arthritis pain refers to pain, discomfort, achiness, or inflammation that occurs in and around the joints. There are many types of arthritis, but the most common ones are osteoarthritis and rheumatoid arthritis. Arthritis pain can have a significant impact on our daily activities, mobility, and quality of life. It may also lead to fatigue, sleep disturbances, and emotional distress. Management of arthritis pain typically involves a combination of treatments, including medications, physical therapy, exercise, lifestyle modifications, and in some cases surgery. But despite the multitude of purported cures out there, vitamin D is still considered the top go-to for the long-term natural treatment of arthritis pain. Let's see why. Bone health. Vitamin D plays a crucial role in maintaining bone health by aiding in the absorption of calcium and promoting bone mineralization. In arthritis, especially osteoarthritis, maintaining strong and healthy bones is essential to support joint function and reduce the risk of fractures. Calcium absorption. Vitamin D plays a crucial role in the absorption of calcium from the intestines into the bloodstream. Calcium is a primary mineral required for bone mineralization, which is essential for building and maintaining strong bones. Bone remodeling. Vitamin D is involved in the process of bone remodeling, which is the continuous cycle of bone absorption and formation, ensuring that bone tissue is constantly renewed. In summary, vitamin D is essential for bone health as it facilitates calcium absorption, promotes bone mineralization, and regulates bone remodeling. Ensuring an adequate intake of vitamin D through sunlight exposure, dietary sources, and supplements can help maintain strong and healthy bones throughout life. Welcome to Focused on Health, the channel dedicated to researching and bringing you the best information on your health and wellness. If you learn anything, please like and subscribe. Also, if you have a story that will bring learning to the channel, please consider sharing. We are glad you are here. Continue watching until the end to see the foods that help you get your recommended daily allowance of vitamin D. Inflammation reduction. Vitamin D has anti-inflammatory properties and can help regulate the immune system. Inflammation plays a significant role in the progression of arthritis, contributing to joint pain, swelling, and tissue damage. Vitamin D may help reduce inflammation in the joints, thereby alleviating arthritis symptoms. Vitamin D can modulate the function of various immune cells, including T cells, B cells, and macrophages. It helps regulate the balance between pro-inflammatory and anti-inflammatory responses in the immune system. For example, vitamin D can suppress the production of pro-inflammatory cytokines. Vitamin D can inhibit the production of inflammatory mediators by macrophages and dendritic cells, thereby dampening the inflammatory response. In summary, while vitamin D is not a direct anti-inflammatory agent, it can help regulate the immune response and reduce inflammation indirectly. Maintaining adequate levels of vitamin D may contribute to the management of inflammatory conditions. Muscle function. Vitamin D is important for muscle function and strength. Weak muscles can exacerbate joint pain and stiffness in arthritis patients. By promoting muscle health, vitamin D may help support joint function and reduce the burden on affected joints. Vitamin D may help regulate muscle metabolism by enhancing the uptake and utilization of nutrients like calcium and glucose, which are essential for muscle contraction and energy production. Neuromuscular function. Vitamin D is involved in maintaining optimal neuromuscular function, including the transmission of nerve signals to muscle fibers. Deficiency in vitamin D can lead to neuromuscular impairments, such as muscle cramps, spasms, and weakness. In summary, vitamin D is essential for maintaining muscle health and function. Ensuring an adequate intake of vitamin D through sunlight exposure, dietary sources, or supplementation can help support muscle strength, metabolism, and neuromuscular function, thereby reducing the risk of muscle weakness and dysfunction. Cartilage maintenance. Some studies suggest that vitamin D may play a role in maintaining the health of joint cartilage, the tissue that cushions the ends of bones in a joint. Preserving cartilage integrity is crucial in preventing the progression of osteoarthritis and reducing joint pain. Collagen synthesis. Collagen is a key component of cartilage tissue, providing structure and strength to the tissue. Vitamin D is involved in the regulation of collagen synthesis, the process by which chondrocytes produce collagen molecules. Adequate levels of vitamin D may promote optimal collagen production, helping to maintain the integrity of cartilage tissue. Anti-inflammatory effects. Chronic inflammation plays a role in the degradation of cartilage tissue in conditions such as osteoarthritis. Vitamin D has anti-inflammatory properties and can help modulate the immune response, reducing the production of pro-inflammatory cytokines and enzymes that contribute to cartilage breakdown. Calcium regulation. Vitamin D is essential for calcium homeostasis in the body, ensuring that calcium levels are maintained within the optimal range for bone and cartilage health. Calcium ions are important for maintaining the structure and function of cartilage tissue, and vitamin D helps regulate the absorption and utilization of calcium by chondrocytes. Protection against oxidative stress. Oxidative stress, caused by an imbalance between antioxidants and reactive oxygen, can contribute to cartilage damage and degeneration. Vitamin D has antioxidant properties and can help protect cartilage tissue. In summary, while the direct effects of vitamin D on cartilage maintenance are not fully understood, evidence suggests that vitamin D may preserve cartilage and reduce the risk of cartilage degeneration. Pain management. Vitamin D deficiency has been linked to increased pain sensitivity. By maintaining adequate vitamin D levels, individuals with arthritis may experience better pain management and overall improved quality of life. Neuropathic pain. Some research suggests that vitamin D deficiency may be associated with an increased risk of neuropathic pain, which results from damage or dysfunction of the nervous system. Vitamin D receptors are present in nerve cells, and vitamin D may play a role in regulating nerve function and reducing neuropathic pain symptoms. Mood regulation. Vitamin D deficiency has been linked to mood disorders such as depression, which can exacerbate the experience of pain. Adequate vitamin D levels are important for maintaining optimal mood and mental well-being, which may indirectly help reduce the perception of pain. In summary, while vitamin D may be beneficial for pain management in certain cases, it's important to note that the effectiveness of vitamin D in alleviating pain can vary depending on the underlying cause of the pain. Incorporating vitamin D into your diet can be achieved through various food sources. Here are some effective ways to increase your vitamin D intake. Fatty fish. Fatty fish such as salmon, mackerel, tuna and sardines are excellent sources of vitamin D. Aim to include these fish in your diet several times per week to boost your vitamin D intake. Fortified foods. Many foods are fortified with vitamin D, including milk, orange juice, cereal, yogurt and plant-based milk alternatives, e.g. soy milk, almond milk. Egg yolks. Egg yolks contain small amounts of vitamin D. Incorporate eggs into your diet by including them in meals such as omelettes, salads or sandwiches. Mushrooms. Some varieties of mushrooms, such as shiitake and maitake mushrooms, contain vitamin D, particularly when exposed to sunlight during growth. Supplements. If you have difficulty obtaining enough vitamin D from food sources alone, or if you have specific dietary restrictions, consider taking a vitamin D supplement. Consult with a healthcare professional to determine the appropriate dosage. Sunlight exposure. Sunlight exposure is an important natural source of vitamin D. Spend time outdoors in sunlight with uncovered arms and legs. However, it's essential to balance sunlight exposure to minimize the risk of sunburn and skin damage. Incorporating a combination of these dietary strategies can help you maintain optimal vitamin D levels. However, it's important to consume vitamin D in moderation, as too much vitamin D can lead to toxicity. Thanks for watching, we appreciate you. It would mean a lot if you would like and subscribe. Until the next video, stay well.